Good afternoon, family. It's me, Lucretia, again with Alpha Health and Wellness, and I was just reaching out to you guys today. I'm off today, working from home, but I have a few errands to run. But I wanted to touch base with you guys because sometimes it seems like I'm too busy to stop. So I just wanted to let you guys know some of the services that we have at Alpha Health and Wellness. We do have medical weight loss where we use semaglutide and tirzepatide. Those are the two main ones that we use, those GLP1s that aid in weight loss. Of course, they were designed for diabetics, but one of the benefits of it is weight loss. And I know a lot of you guys may hear of Ozempic and Zepbound, Wegovy, and a couple of others that they have as well. Well, that's pretty much the more expensive brand names, but tirzepatide and semaglutide pretty much does the same thing as both of them, or of the few brand name ones, because those are the main ingredients that are in the Ozempic and the Wegovy and what's the other one, Zepbound. Okay, so what happens is with those GLP-1s, what it does is it tells your brain, especially the tirzepatide, that has two different functions. Tirzepatide tells your brain to tell your stomach that you're full. Okay, and it also slows down the GI tract to make you feel full, and that usually makes you have less cravings, less wanting to eat as much, because you feel so full and satiated that you don't really want to put anything else in your stomach at the time. Now with both of those GLP-1s, we always start off slow and look out for any side effects that patient may have. Some of the side effects associated with semaglutide and tirzepatide is constipation. Most patients will say that they're constipated, and of course, it makes sense. If your GI tract is slowing down, you're gonna feel constipated. But of course, there's ways to combat that. You could take Marilax, you could take fiber, you could drink more water. Of course, you want to exercise. Movement will help with constipation as well. And don't eat a lot of foods that cause constipation as well, like flour, like anything that's, flour, like bread and that, that type of foods. And that will help. Some patients also experience nausea, which also makes sense, because with both of them, or with all the GLP-1s, the biggest thing is GI upset. So nausea, of course, is one of the GI upset. But as you take the medication and it gets used to in your system, sometimes when you go up on a dose, it all depends. If we go up on a dose too quickly, you might feel that nausea as well. But that's another one of the things. So the main two things that patients have is constipation. I haven't had much patient report diarrhea, but constipation and nausea, which subsides, it goes away. Okay, and of course you have to eat a healthy diet. You want to have your fibers, you want to make sure you have your protein, because protein aids in weight loss. You want to make sure you're drinking a lot of water as well, and because that helps as well with your weight loss. Sometimes when you think that you're hungry, you're actually thirsty, and sometimes you just need to drink. Put yourself in a caloric deficit as well. So you want to eat from a window of maybe from 10 to 6 or 10 to 8. And in between that time, of course, you're going to have some healthy meals and snacks. Okay? But protein is very, very important when it comes to losing weight. Water, fiber. Okay? Those are three things that you want to make sure you're including in your diet. But these GLP-1s are very, very effective. People have been using it for a few years now, and it's been working pretty well. Of course, prior to that, I always want my patients to have a physical done, so we see your baseline, see where you at, because one of the things that we have to look for prior to you even starting a GLP-1 is if you have any type of like thyroid disease or thyroid cancer. Thyroid disease is not the big deal. It's if you have thyroid cancer, MEN, thyroid cancer. We also want to make sure that you don't have pancreatitis, because those are the two things that patients are more at risk for with those medications. Not saying that it's going to happen, but we want to make sure that prior to that we do our due diligence and you know, make sure that you're in a good space, healthy space to get started on the medication. Some patients also take phentermine. So the patients who can't afford the GLP-1s, because the GLP-1s you get injection once per week. Okay, you choose a day. It's a sub-Q injection, very small needle, like an insulin needle that you will inject either behind the arm, your abdomen, the top of your thigh. You could also inject, and you do that once a week until you reach your desired weight. Now, it is not a miracle drug. Like I tell my patients, it's not a miracle drug. You want to make sure that you're doing your part. You want to incorporate some healthy habits. So you want to be exercising. You want to at least do some walking. That's the best exercise you could do. Walking, swimming, and that helps as well. Being on a caloric deficit. Avoiding a lot of sweets. Avoiding a lot of, you know, flour like bread and pasta. You still need them because those do convert into the energy that we need in order to, you know, have our energy for day to day, but at the same time, everything in moderation. Okay, so if this is something that was informative for you, if it's also something that you want to you know, jump on for your medical weight loss journey, just let me know. If you have any questions, and feel free to reach out either on TikTok, on YouTube, or you could give me a call at 770-572-9705, and that's the number for our clinic at Alpha Health and Wellness. So if you guys have any other questions, feel free to give us a call, and we will see you on the next one. Bye.